Welcome back. And today I'd like to talk to you about the stresses of the COVID crisis compounding the diagnosis of breast cancer. And I was able to do a wonderful interactive interview with my amazing colleague, Todd Hartley, who is the executive director of WireBuzz. He's also started Breast Cancer Answers, and we did a live chat the other morning through the American Society of Breast Surgeons Foundation. And I think there were some really great pearls of wisdom that came out of there. And I wanted to share them with you in case you know anyone right now who's been diagnosed with cancer, any type of chronic disease, something that's uprooted their life. Because during a time of crisis such as COVID, another crisis, another diagnosis, another stress on top of it can be enough to just tip somebody over the edge. And we want to make sure that everybody has access to the phone number for the suicide hotline, where someone mans it 24/7 in person, and encourage people to reach out. And if you're watching this and you need to reach out for help, call your doctor, call a friend, get online with somebody, because social isolation is one of our greatest risk factors for not doing well through anything. And right now, social isolation is what everyone's being required to do to get through COVID. So I hope you enjoy it.
Hi, and thank you for joining me. This is day 5 of a really great series where we're advocating for patients. My name's Todd Hartley, and I'm doing a live feed of interviews all week long. And today I'm going to be joined in a few moments by a remarkable breast surgeon out of Sedona, Arizona that you all need to know about. And we'll get to that in just a second. But this event is put on by a partnership between Breast Cancer Answers, which I was lucky enough to co-found with Dr. Jay Harness back in 2011 when my stepmom was diagnosed with breast cancer. Dr. Harness is a past president of the American Society of Breast Surgeons. And we also are partnering with the American Society of Breast Surgeons Foundation. Their website is breast360.org. And so we decided that we wanted to use this time, this opportunity, to make sure that we could advocate for patients, because now more than ever during a crisis is the time where advocates stand up, they grab the torch, they lead patients, and now is our time to be able to do that for other people, especially while we're all at home. So today I want to take a few moments and talk with you about PTSD and really what happens, the mental and psychological effects for breast cancer patients. And we're going to get to that. And I also want you to know that if you have any questions that are non-case specific, because I think we all know that the questions that are specific to your case should be best handled by your physician. But if you have some broad questions you'd like to ask, please feel free to put it into the chat comments. And if I see it, recognizing I'm juggling a bunch of things and it's relevant to where we are in the conversation, I will bring it up and get it answered. And so let's get ourselves going. I'm joined right now by Dr. Beth Dupree. She's a breast surgeon out of Sedona, Arizona. And Dr. Dupree, thank you for joining me.
Okay, Todd, I think I might have screwed up technologically here because
really? Okay. So let me bring the audience in before you get going.
Me.
Let me get the audience. Let me let them in on our
Go
joke.
for it. Bring them in.
So I told Dr. Dupree, I'm going to go live and I'm going to, for about 2 minutes, set up the conversation. During that 2 minutes behind the scenes, go to your page and start sharing it to people that follow you, because she's got a great following. But Dr. Dupree, did I go too quick to you?
Well, you know what? It's just hard because I couldn't tell if you could hear on the computer because I started finding you on my computer. Now I'm being a little smarter because I am going to put it on my regular, like I'm figured out I can do it on my phone. So I'm getting it. I just need one more second, and then
you
I
do
will
your
be
thing, and I'll do my thing. As a former talk show host, I know how to buy time and fill air. It's one of the things I do best in my life. So Dr. Dupree moved her practice from Philadelphia to Sedona, Arizona, and the two of us met in the exact place that friends probably never get to meet. We met in a cadaver center, And we just hit it off magically. I was there to interview her. She was there to train surgeons from all over the world on how to use the latest techniques. And in the process of that, we just became friends. And I get to interview Dr. Dupree wherever she's speaking around the world. Like, let me give you an example. We were both brought to Amsterdam for about 4 or 5 days for the European Cancer Conference, and we did a series of interviews there and had a lot of fun.
And I
And
drank out of that coffee mug this morning just because of you, the one that I pinched from the Dylan, because they
yes,
gave me when we were sitting out in the lobby and in the courtyard, and the guy came back smoking a joint
yeah,
behind us in the
yeah,
middle of our interview, which
we
you
were
can't
doing
make that stuff up.
a live interview, and then we could see in behind us that a guy came up in Amsterdam and just started smoking his joint. We had to like shift the camera while we were doing it live.
It's
That's a
all
good
good though.
time.
It's all
So
good.
Dr. Dupree, I want to talk with you about the mental and the psychological, emotional toll that a breast cancer diagnosis can create, especially in the midst of COVID. Can you tell me about what you see right now as we're going through pandemic and it's basically a double crisis for a patient? What are
Oh
you
yeah.
seeing manifest in their emotions and in their life when you get into the patient room?
So I talk about breast cancer in the sense that people we tend to compartmentalize our lives and keep things. I say if you've got a 4-piece set of luggage with all of your life stuff in it, you pack it nice and neat in your luggage because you got to carry that with you every single day. So you can't have it all over the place. So you package up your luggage really nice with all of your life stuff, the kids, the husband, the work, the whatever, the family, the who you care for. And when you get diagnosed with cancer, it's like somebody takes that 4-piece set of luggage and opens it up and just goes poof, and it's all over the place. And you have to figure out how you reorganize all that stress. So you have to realize that someone getting diagnosed with cancer right now, COVID has already taken their 4-piece set of luggage and the crap's all over the house. People are trying to figure out how are they going to pay their bills? When are they going to get back to work? Who in their families at high risk for dying and living through COVID. And you're suddenly then thrust into this world of, oh my God, I have cancer too. And
Yeah.
so we know that 82% of women get PTSD just from a diagnosis of cancer. So now you take someone who is in the midst of a pandemic where everybody in the world is feeling off kilter. We don't have a normal right now. And you give them the diagnosis of cancer, and they come into my office, and not only do they need the assurance of I'm going to get you through this diagnosis of cancer, they need I'm going to get you through this diagnosis of cancer regardless of what you need in the midst of a global pandemic.
Okay, wow. I counted 5 different crises that could potentially be happening in a breast cancer patient's life at the same time, especially when moms are the quarterbacks of the entire family. So job loss for anybody in the family,
Yep.
the how are we going to pay our bills? That's another one. I mean, there's so many. The kids struggling, and before you know it, you've got way too many crises to manage at one time. I like to say I can manage a ship with one, maybe 2 crises at one time, but if a third one, I really start to destabilize. How do you how do you coach a patient through something like that?
And so this is really about prioritization, and it's no different during COVID than it is during any other time. It's very, very hard for the CEO of the family who's used to taking care of everybody else first. I bring them back to the place, and I give a pink rose quartz heart, which I have sitting in the my desk behind me. I give the patients a pink rose quartz heart, and I ask them, who is the most important person in the world? And most women don't recognize that it has to be them, because if you don't take time to take care of yourself, you won't be there to care for others. But it's even more intensified because now it's this isn't just I have cancer and I have to treat it. It's, am I going to lose my health insurance? How quickly can I get my care because I am furloughed from my job and I'm only going to have insurance for so long. So the
Oh,
most important thing is to bring them back to the place where you sit right there and say, we need to take care of your cancer. We need to bring everything into perspective, because you and I both know that we have the ability to know the biological behavior of tumors. The majority of tumors or genomically, meaning how the tumor behaves, are going to be tumors that we can safely buy time, meaning we could put people on tamoxifen or anti-estrogen medicine to kind of get them across this bridge to a place where there's going to be less stress to treat the cancer. We've been doing it for years. It's called neoadjuvant therapy, where we give anti-estrogen medicine, or medicine that goes targeted to the estrogen receptor to actually stop the growth of that tumor and actually make it regress. So a lot of patients, we've been able to do that. The American Society of Breast Surgeons collaborated with a lot of really smart people, and they put, we did the COVID-19, we did the classification of where do people fall in class A, B, C, or D, and how do we stratify patients to let them know, I do this all the time. I have patients diagnosed with cancer, so I'm not doing something different now. All I'm doing is taking strategies that I've used for years and given a broader, we have a broader brush with it, because we need to get patients into a place where we get rid of the fear that the cancer is going to take them out right now. And that fear is the part that it paralyzes every woman at the diagnosis of cancer, or every man. But that fear is escalated because of COVID. So number one, bring them back to a place and say, listen, I got this with you. They need to hear confidence in their caregivers. And if you're not hearing confidence in your caregiver, vote with your feet and get a second opinion, because I am still giving chemo during COVID. I'm still sending patients to begin therapies, because that small percentage of patients that need that therapy, we're educating them about how to isolate at home, how to take care of their immune system, all the things they can do. But we have to get to a place where we have a plan of care. And now we've come up with COVID plan of care appointments, where we're just connecting with patients and then it's the treatment, to make them know that we've got them. We've got them, and we've got this.
So a leader stabilizes. And
Bingo.
that's what I'm hearing, right? And as the surgeon, you're typically the quarterback of that entire patient's care and experience, but you can't stabilize them if they're focused on the wrong thing. Like, what is the Tony Robbins saying? It's like, where your thoughts go, your energy flows.
Yep.
And is that part of the quartz? Because I know you gave me a quartz when I met you in that cadaver center and to give to my wife. And part of that experience is when you ask somebody what is the most important person, and they say, eventually they say themselves, you're getting them to focus on what the most important priority is. I think that's what I'm getting out of that.
Right. And the other thing is, right now, I usually do a psychosocial evaluation on a patient anyway, based on, what is their support system. One of the biggest problems right now is we're being asked to socially isolate. So when someone's diagnosed with cancer, and I have a patient who just recently went through surgery, and she said, I had to go do my COVID testing. We had to test her to make sure she didn't have COVID. And she said those days of isolation, those 6 days isolating from her family who's in her house, because she's got kids. And she said those days of social isolation, getting to surgery, it's like, it would have been a lot easier for her if she could have sat there and, been side by side with her husband and kids and everybody else, but she needed to protect herself. And so social isolation is one of the determinants of how people do through any healthcare situation, whether it's hypertension or heart disease or diabetes, and certainly cancer. So now we are isolating patients prior to their surgery to make sure that they are safe, because we don't want to put someone to sleep who's got, asymptomatic COVID and set off an explosion. And those are the things that, if someone has underlying mental health issues, depression, anxiety, insomnia, the ticker tape can keep going, and you create this reality in your head. And yes, your thought forms and beliefs are so important, because when you can stay in a positive space, and that's, I know it happens to me. Like we are all susceptible to this. When we talk about the healthcare crisis, meaning the healthcare mental health crisis right now, is practitioners, doctors, nurses, they're going through repeat, constant crisis and trauma, like traumatic grief and loss. They're with people when they're dying, and they're not allowed to process it. They don't have the time where they get together with their group, where they get together with our people, and we talk about it. We say, how is this affecting us? Like, when you're with someone and they're dying, and you can't go through that grief process and process it, and you go back the next day and it's repeat trauma, repeat trauma, repeat trauma.
we're being put in a situation where the healthcare providers are feeling it. And right now, it's kind of it's not just a global pandemic of to me of COVID. This is a global pandemic of mental health, because what it's doing is it's bringing all this stuff up to the surface, and we need to recognize that everybody needs healing right now, not just the cancer patients, but you take the entire world. You give a woman a cancer diagnosis, and you have to recognize he or she needs an extra level of compassion,
Yeah.
um, an extra level of just listening and hearing what their concerns are, because you can't just give advice. You have to actually listen and hear what someone's saying.
Yep. There's so much to unpack right here. When you're dealing with a healthcare professional that is now there holding somebody's hand as they're dying, they may not have ever been trained or mentally prepared to be that last person. And now they're pushed into that situation. When I was a reporter on location covering the first anniversary of 9/11 and was interviewing first responders, Dr. Dupree, I heard the same thing, that they were still in the process of of getting themselves to some type of normalcy because of the crisis role they had to play. Now, PTSD is a term we used at the beginning. For those that may not know or have heard the acronym but may not know what it is, we're going to spend a few moments on it. But post-traumatic stress disorder is a mental health problem that can occur after a traumatic event like war, an assault, a disaster, or being asked to be a patient under severe crisis or a healthcare provider under severe crisis. Dr. Dupree, when a patient presents with PTSD, like what are some of the signs that a healthcare provider would see?
So first of all, just know that PTSD, 82% of women will present with PTSD at a diagnosis. This is from the Journal of Psycho-Oncology from 2016, a German study. So that's part of just a regular diagnosis of cancer, because you are faced with your mortality. You are faced with multiple decisions of your physical, psychosocial, emotional, like the things that are going to change in your physical body through a cancer diagnosis. But the
Yep.
signs that people need to look out for are, nightmares, having night terrors where you wake up in a cold sweat, like in the middle of the night, having, bizarre thoughts. I've been having some nightmares too, because of this whole process where I wake up and I go, okay, well, I didn't really drive my car into the edge of my, in the edge of
Right.
my garage when I was pulling in. That was a dream. That was a nightmare, because my husband won't be happy about that. But um, continuously refocusing on the cancer experience, letting the cancer consume your thoughts, irritability, emotionally numbness, feeling as though it doesn't matter, like losing that sense of feeling, loss of appetite, self-destructive behavior, thinking that the second glass of wine is going to take away the stress, or people who already have had an addictive personality, maybe wanting to reach for drugs, alcohol, cigarettes, people being startled easily, hallucinations, difficulty with memory, difficulty with concentration. These are all signs of PTSD. And we all, when you get repeat trauma of the same level,
Yeah.
it continues to hit you. I went through it recently with a quality situation where every time I kept seeing the same situation over and over again, I didn't realize it, but it was like, it's almost like that cellular memory where your body recoils back into that spot. And
Yeah.
we need coping mechanisms. We need ways to be able to take a step back. And I think one of the things that for me is so important is knowing that, I know that my soul is eternal. I believe that I am in this body, in this lifetime, living this, earthly experience. And I think that for most patients going through cancer, for the very first time in their life, they are faced with their mortality. Right now, you cannot turn on the TV without every person on this earth thinking, oh my God, if I get COVID, do I have hypertension,
Right.
diabetes? Am I obese? Am I elderly? Because we're thrust into a place where every single thing on television, and one of my first advices to my patients, do not go on the internet. Do not go on don't watch the nightly news all the time. Don't watch the things that are constantly going to bring you into a place that instill fear. Like, I want the GNN, I want the Good News Network right now. I want you and
Yeah.
I to put together the Good News Network, where we're going to talk about all the great stories and all
Yeah.
the good things that are coming out of this, because I think when we look back at the COVID time, our planet was diagnosed with a cancer. It's a virus, but it's a virus that's acting like a cancer because it has metastasized globally in a heartbeat. It was a fire that flew around the earth, and it's affected everybody. My dear friend's husband is a captain of a cruise ship, and right now, um, he's been on that ship for months, and he's dealing with his crew members and their psychosocial, emotional well-being, his own. Like, how do you get? And nobody's thinking about everybody else. Like, I have colleagues in Russia who are breast cancer surgeons who are now on the front line of being in the ICU as a COVID provider. I thought I was going to be. I thought, 6 weeks ago when I was watching this, I was going back and learning how to run a ventilator and running drips and doing things like that. So we've all gone there. But right now, like for me, I am on the front line with my patients. I have 40 some patients diagnosed in this process. And my goal is to get each and every person through this process. Now, what we have to do is see that each person has a different set of needs, and some people need intensive psychological counseling and intervention. Others need to have the ability to take a step back from their life and say, all right, let me take stock of all the blessings that I have. And this is where I think a gratitude journal is a wonderful thing at this point in time. We all forget what we're grateful for. We all forget all those things that are going well in our lives. And to get into a place of gratitude, you cannot be in fear and love at the same time. So, like, one of my greatest pieces of advice with my patients is take stock of the time that you have now to spend with your family, being home with them, having them there to support you. Although you might be isolated for 5 days while you're waiting for surgery, think about the fact that otherwise you wouldn't have your family members sitting there with you. They would be out working and you'd be, literally by yourself. So I think there are a lot of blessings that we can find in this process. But like Dr. Monique Gary shared with everyone is that the whole world is getting the wake up call right now that typically a breast cancer patient, what Wendy's diagnosis, how it changed everything in your life. And you do not live a life of fear. You guys, you're, balls to the wall. You go for whatever is out there, that brings joy into your life. And that's what it's about.
You're spot on. Time's limited and every moment is precious. And so, we've gone through crisis far too many times. I think there are resources available, and at least I know there are, and they're different in every city. And Wendy wouldn't mind me sharing this, as advocates, it's important for us to be candid. When Wendy went through her breast cancer, it was naturally a traumatic experience, and it was hard for us to get back to life as we knew it. And so Wendy went and sought therapy and got help at her breast center. So her breast center provided resources where she could sit down with a professional and deal with the post-traumatic stress of going through it. How common is it for services like that? Because I know at our facility, there were plenty of services, but if it isn't common, where could a patient find that kind of help to be able to talk with somebody and get some private coaching so they can get back to a new normal?
So there's a couple of things. First of all, not being isolated, we have taken all of our support groups and put them on Zoom. So now instead of having in-person situations where you may have 20 people in a room, we'll have 50 women on a Zoom call. And it's wonderful because energetically you're connecting. You may not physically be there, but you're getting that connection with the group, because women that use support groups do better stage for stage, grade for grade. We know that. Second thing is, like my foundation, the Healing Consciousness Foundation, we've taken all of our services that we can offline. Like, we're not allowed to do in-person services, but you can get one-on-one counseling. There are breastcancer.org has an amazing chat room situation where women can go on and become part of chat rooms. Facebook has just increased the number of people that can be on a call at the same time. And there are lots and lots of breast cancer support organizations online that allow you to have that level of connection. Here's my thing. If you are a woman diagnosed with breast cancer right now, and you're thinking of harming yourself, or you can't get up in the morning, or you just cannot get a handle on it, you need to contact your surgeon, your oncologist, your nurse navigator. You need to reach out, because we can't help you if we don't know that you need help. At the end of this, I'm going to post the suicide hotline number, 800-273-8255. The National Institute of Mental Health has the opportunity to help bring these services forward to patients. And the last thing that we want is for someone to feel as though they're in isolation and they don't have someone that they can talk to. Most cancer centers, our cancer center at Northern Arizona Healthcare is NAPBC accredited. Our center at Holy Redeemer Health Center, NAPBC accredited. By having that accreditation, it means that you have nurse navigators as part of your team. Patients should feel free to reach out, and you don't have to reach out with a, hey, my incision looks red. It's, hey, I'm really scared. I need someone to bring me back to center. I need a resource. I need something. On my website, drbethdupree.com, I have uploaded my sister Sue, who's a psychologist. She has a wonderful yoga nidra, which is a 19-minute meditation. It brings you to center. It takes you out of your brain and brings you to a different place. And I think we're going to see a whole new aspect of how we do our psychological process, because initially my sister in Australia said people who couldn't see her face to face were like, yeah, I don't want a session. She's busier now than she's ever been, because during times like this, you have to have that connection. And it's very different for me to be on the phone with you than to see your face, because I can see your eyes, I can see your reaction. And this is exactly where, like I told you, I'm working on my second book, Shifting Gears. This is about shifting from letting technology run our life to using technology to our benefit. Let's create these connections where you can see people's eyes one-on-one, because energetically, I feel you. Like even though you're in Scottsdale and I'm here in Sedona, I feel that energy that you have, because you care enough to be up on a Friday morning, going on a Zoom or whatever, this Facebook Live, to be able to put this message out there. I know there's so many platforms, but
so many.
I know, but we have to use the resources that we have and make them work to our benefit, not let them drive us. Watching the family of four in the grocery store doing this when they're not talking to each other or they're not connecting. We're using technology to connect to the rest of the world. And this is where you have that gift. You can light up a room and get people to understand that they have the power to choose love over fear. That's what it's all about.
Every single time. I love the gratitude part. My morning ritual before I get into the office, before I interact with other people, is to exercise and exert, fitness first, because it allows me to burn off my fear, and it allows me to center on what I'm grateful for and how much I want to give love and share that love. And you mentioned earlier the role of the nurse navigator. You also mentioned that people can't help if you don't let them know that you're struggling. And so, we have a question here from Natalie. I'm not going to get into Natalie's question because it's more personal. And I want to make sure that Natalie heard what you just said. Natalie, please reach out to your physician's office and ask them for guidance, because they can help you answer that question about pain that you're experiencing more intimately than Dr. Dupree or I could. And it's important that you take that step to start advocating for yourself. And the first act is an acknowledgement and then reaching out to somebody who could be of service to you. Dr. Dupree, I noticed that as soon as Wendy and I started helping other people that were going through it, it helped us through our own recovery process. I'm sure you see this a lot. And that's also like when you're talking about the support groups have to be invaluable for a patient to be able to be there with others that have already gone through it or are going through it now. How common are these support groups? Are they expensive? Like, give me an idea.
Most support groups do not cost anything. We have a support group for patients going through metastatic cancer that my foundation pays for a psychologist to facilitate it, because I needed to make sure I had someone who can be present and be like that stabilizing, balancing force. Most support groups are run by survivors and women who've already gone through this journey, who have utilized these healing services. And, the best part about the support groups within my purview is that when they see someone who is having additional needs that they can't meet, they can reach out and say, I have a concern. And that is so vitally important, because sometimes you can recognize that someone else is slipping over the edge before they even see themselves slipping. And having that sense of connectedness and being able to be that bridge for that person can be like priceless.
Yeah, absolutely. We got a question in from the audience. A gentleman named Josh said, because of COVID, do you expect to see an influx in a few months where people start getting the care, the mammograms that they've been avoiding? Like, is there going to be a long waiting list because there's people backing up and so on?
So I don't think it's going to be as long of a waiting list as people expect, because we are ramping up. We're starting screenings this week. Many centers are starting screenings this week. And what's going to happen is we've been pretty much down for 2 months. So it's going to be like a little bit of a backlog, but this is where we as doctors triage, and we go, okay, we look at the patients, we look at their age, the stage of the cancer, the type of the cancer. And my goal as a doctor, and I know all of my colleagues across the world, we want to make sure that we stratify those patients to get the people in urgent or emergently. Breast cancer is not a surgical emergency. It's a psychological and emotional emergency. But there is a small group of patients that require more urgent treatment, meaning we need to get them in, to get them their chemo and the things that they need to begin to treat that systemic cancer. And that's a small group of patients, but this is where, as a team, like my breast imagers communicate with me, communicate with my navigators. And this is where, working it within centers of excellence, where we have those pieces and parts to bring it all together, is going to make a huge difference. And if someone's living in an area where they have a big family history and they're not open for screening yet, find the closest area that's open for screening for you if it's a concern, because psychologically, putting things off, you start to create a reality in your head that's probably not real, and you just need to have that reassurance that you're fine.
And every time in my life I've put something off, I've actually made it more difficult, because I have to manage the emotional side of putting it off, when actually doing it is easier. Now, Josh, you ask a really good question about screening mammograms. I know it's an important topic. If you want more information on this, yesterday I did an interview with Dr. John Williams, who's the chairman of the President's Cancer Panel at the White House. And he talked about screening mammograms. Are they available now? And should I get mine? And everything you really need to know will be inside that conversation from yesterday. You can find it on the American Society of Breast Surgeon Foundation's Facebook page, or on Breast Cancer Answers Facebook page, and watch that interview. I know it'll be valuable to you. Dr. Dupree, I know we're pushed up against time. You've got a busy day. If you could, we discussed giving a hotline out for people that are feeling suicidal, that might be dealing with some issues. Anybody that might be experiencing that, please get a paper and pencil ready. We'd like to make sure you have the most important resource, which is a warm human that specializes in helping and coaching and guiding or giving people support, and they're available to do that. Dr. Dupree, where should people call if they need help?
So the suicide hotline is 800-273-8255. And then we have the National Institute for Mental Health that can just be there as a resource, where you can get a live answer as well. And that's 800-273. It's the same one, 8255. And in Spanish, if someone is Spanish speaking, or they have a family member who speaks Spanish, it's 888-628-9454. And the most important thing is, if you feel bad, ask for help. It's not unusual. It's normal to feel stressed at a diagnosis of cancer. It's even more normal to feel twice as stressed with the diagnosis of cancer during a global pandemic. It's not unusual. You're not different. You are exactly where you're meant to be. You just need to get the help to get past that point and get out of fear and into love.
Beautiful. If you need more Dr. Beth Dupree in your life, and and you want to know where to get started, she wrote a fabulous book, The Healing Consciousness. It's a doctor's journey to healing. My wife read it when she was going through her care, and it helped Wendy tremendously. There's also, if I understand correctly, there's an audiobook version. Is that right?
It is on Audible. Yes, it is. And it's available for download. And if somebody can't afford it, you can message me through my website, Dr. Beth Dupree. I'll give you a download. I have a YouTube channel. Again, it's pretty easy. It's always at Dr. Beth Dupree. But on my YouTube channel, I'm really trying to help. I'm going to do a segment next month on cold capping for chemotherapy. I'm going to do a segment on social isolation and how to avoid it. Some stuff on gardening and making your own garden and creating that. And I haven't figured out exactly what else I'm going to do yet because I have been busy this week, so I haven't given it much thought yet. But I want to try to reach out and get people engaged and involved because you don't have to be isolated just because we're in isolation.
Beautiful. And in the interest of full disclosure, when Dr. Dupree, when you hear the audiobook, if you decide to go that path and not read the book, Dr. Dupree did the audiobook in this exact spot that I am in right now, right? And then we went and got to have dinner after she went and recorded. Dr. Dupree, it's always an honor to be able to take your wisdom and help patients around the world that are coping with breast care issues or even the mental and the psychological issues that come from a diagnosis and even a pandemic. She's Dr. Beth Dupree. For more on her, please make sure you go and look at her book, The Healing Consciousness, A Doctor's Journey to Healing, her website, drbethdupree.com. And she's out of Sedona, Arizona, which is, for those that don't know, the greatest place in the entire world for healing.
Oh, yeah.
Right? And that's an hour and a half north of the Phoenix area. And we're honored to have her in Arizona as one of the rock stars in the fight against breast cancer to call Arizona home. Dr. Dupree, thank you so much for joining us on this very special broadcast. Yeah.
Have a wonderful weekend and hug your bride because you're allowed to hug her because you're not socially isolated from that amazing woman.
I promise I will. Thank you so much.
All right. Be well. Bye-bye.
Bye-bye.